Awesome. Well, thank you to our viewers for another episode of Continence Chat. My teammate Susie and I once again appreciate you listening in. We've got a fantastic guest today, Dr. Brittany Lamb. Many of you may be familiar with her if you're in the dementia circles. She's very active on LinkedIn. Before I pass it over to you, Dr. Lamb, with an opening question, I just wanted to say, hi, Susie. How are you doing?
Doing well, and glad we're back together again. So
yes,
another fun episode, and a pleasure to meet you, Dr. Lamb.
Yeah, same here.
Ah, awesome. So Dr. Lamb, first and foremost, you were one of the speakers this past April at our caregiver forum. Thank you. We still get good reviews from that. Do you mind just sharing what you're currently doing? Because I know you took on a new role. I know you're an ER physician. I know you've got your training, but I feel like you've got your hands in a lot of wonderful things, and you can probably do a better job than I of sharing.
Yeah.
Great things.
Yeah, sure. Yeah. So I think I've been pretty burnt out since I started emergency medicine. And a few years ago, I decided to come online and start educating the family members, mostly the people who are making medical decisions on behalf of their person living with dementia. So I do that online. I put together a lot of free resources, but I also sell a course product. It's called Make Your Plan with Dr. Lamb. That's one thing that I do. And so I'm still working in the ER. I'm doing that. And I recently, just in September of 2024, cut back a little bit in the ER. And I'm starting a new job as a medical director of a hospice facility. Well, not a facility, it's a service. So they're not inside of any one facility. So I just started that. So we'll see how that goes. Yeah, and that's kind of the work that I'm doing right now. I have a passion for making sure that people who are aging receive the type of care that they would want when they're not able to speak for themselves, and whether or not that's because they're living with dementia and they've permanently lost capacity at some point, or because they're sick or injured and they're needing their family members to kind of step in and help them. I feel like there's not enough education and support of people in like what to expect from their underlying medical issues and kind of what decisions might need to be made because of those things and what they're at risk for. So people need access to more education. So that's why I came online. We just don't have enough time in our very quick doctor visits with people. So
yeah. And do you find in the ER, are you finding people that are aging an older demographic that are coming in? Because you work the night shift, right?
Yes.
At the hospital. I think you shared that with me. So does it vary night to night, or do you find, because where I'm going with this is we read a lot about falls being the number one or two reason of why people over 65 end up at the ER. That's kind of where this is stemming from. Do you find it just varies, or do you find that holds true?
Yeah, that's true. I mean, that it's extremely common. Falls are extremely common. I mean, people coming from living facilities tend to come because of some concern about a medical problem. And a lot of times, if a person's living with dementia, someone's concerned that they have a change in the way that they're acting, their behavior, they can't quite figure it out. They're concerned about some medical issue they already have that's gotten worse, or maybe an infection. There's lots of things that can cause change in mental status, but those are the two big things: change in mental status or behavior, and then falling. And falling for all people who are aging, but those are the two things for people living with dementia, the things that I see most in the ER.
Gotcha.
When you say changes, what types of changes should people be looking for?
Yeah, so any like sudden or abrupt change in someone's ability to function, to communicate, some people living with dementia have behaviors. I don't really like that term, but symptoms of the disease. So confusion, pacing, wandering, like it depends on the person what their symptoms are. And if those things get heightened, or there's new symptoms that are kind of all of a sudden very abrupt, it's not something that you've been noticing gradually over time, or something that has happened to them for, months to a year or whatever. If it's something that's very new, within hours, days, a few days a week, that could be a new medical problem. And so it just changes the it changes the way the person interacts with the people around them, interacts with their world. And the symptoms can look different for everybody. Somebody could be more upset, anxious, agitated. Someone could be completely withdrawn and not communicating as much. So, yeah, and it depends on the medical situation that's happening too, because people who are aging, people living with dementia can have medical emergencies and things that happen to them just like anybody else can. So, yeah.
Mm. And is there, I know you do a lot of education around dementia, and I think from what I've read, learned, and spoken with you on the proactive side for people to be more proactive. Are there one or two suggestions that may delay the symptoms of the disease of dementia, or a couple of things that you say, check here, of almost proactive?
Oh, yeah. I think that, well, so dementia is an umbrella term. There's so many different diseases that can cause the symptoms of dementia. And dementia is really just a person's not able to function. And that's the difference between normal aging, right? And dementia is that a person that is living with dementia is having trouble functioning in the world and they need help and support. But in the earlier stages, when somebody notices cognitive changes, like they're not thinking the same, they're forgetting things, maybe they're getting lost, I think it's really important to seek help and to seek testing to try to figure out what disease it might be, because there are other conditions like that can be reversed. There are vitamin deficiencies, thyroid issues. There are structural things that happen in the brain that could be treated. So I think the earlier we can identify that the person's having a change in who they are, get them tested and potentially diagnosed. And what that looks like depends on where they live and what access to care they have. But neuropsychological testing can be a really helpful tool. If you then think that the person has Alzheimer's or some other disease causing dementia, I mean, we know the things that help with brain health. It's all the things that we know we're supposed to do. So we're supposed to sleep well. We're supposed to not drink heavily. We're supposed to eat a well-balanced diet, get daily exercise, and move our bodies. There's a lot of things that can be preventative. I think it's hard to generalize because it really does depend on the person and like controlling any medical problems that they have. Like if someone's living with high blood pressure, high cholesterol, diabetes, like we need to make sure that those things are controlled well. And if they're pre-diabetic, like maybe we can do some dietary, changes to decrease the chance that they actually develop diabetes. So yes, there's a ton of things, but I think we kind of shy away. Like I think people, like I know that if I had symptoms of dementia, I would be afraid and I would maybe want to cover it up and not really talk about it. And I may not want to let the people around me know that I'm struggling. And I think that the more we can be open and just talk about that there are things that can be done, and it is not a diagnosis. Dementia is not a disease itself, so you don't diagnose dementia, but it doesn't mean that a person can't live with good quality of life and that there's all hope lost in their life just because we've diagnosed a disease causing dementia. So, yeah.
Yeah. You raised a good point about that, especially I think with early onset, because from what we've learned, right, is you could have someone who one day everything appears fine and the next day there's forgetfulness, but something as they start, which would be scary if you are that person, of things happening like that. So that's a great point.
If we had someone watching this right now that was afraid that perhaps they could be displaying symptoms, what words of hope or wisdom could you offer them?
Yeah, I would say that I think that, it's normal to be afraid, and that I think if you can tell other people who care about you, who would be there to support you, that you're feeling that way, and that you're noticing these things, I think that being open about it with people that you trust, maybe asking if somebody would come with you to see your doctor, just to be there as support. And and don't go online and start like going to the worst case. Like go see the doctor and talk to them about your concerns and the symptoms that you're having and what you're noticing, and let them do the medical assessment to see if there's anything that can be done. Like, can we figure out if there's something else that's contributing to this? And be mindful of your mood like because depression can overlap, those symptoms can overlap with symptoms of dementia too. So it's just because you're noticing something doesn't mean that that's what you have. You have to go and get checked out. So lean on the people around you to help you kind of go through this. Don't try to do it by yourself, and don't ignore it.
Yeah. Thank you. I wanted to ask you, Dr. Lamb, too. Susie and I and our teammates have become very passionate about incontinence and managing incontinence and improving incontinence first. But then when it comes down to wanting products, how much training is there for physicians about incontinence in general, and then incontinence products will be step 2 of my question.
Yeah. Yeah. So, I mean, we learn about incontinence because there are interventions from a medical standpoint and also like physical therapy interventions for incontinence, but products are tough. I mean, we're not really taught much about products. I think that, and I could be wrong. I'm an ER doctor and I've been working full time and in the ER for 10 years. So I've been out of medical school for a while. And I don't know what the rationale would be about products. Like maybe it's because when you learn, there's like all these new things that come out. Like external catheters were not a thing when I really started my residency. We didn't use those in the ER. And now we use them for everybody, like Foley catheters were like what we did for most patients. So, maybe it's because of evolution of products that they don't always teach us. And then I also think that nurses and the people who are actually like providing the day-to-day care can be some of the and family can be some of the people who are better able to know which products would work for their person. And so I think doctors don't know what questions, like I'm not sure that I know what questions to ask in order to figure out which product someone would need either.
Yeah.
So like definitely nurses would be good. Like I feel like they would be better than a doctor in a lot of instances. So
Yeah.
and maybe like occupational therapy.
Yeah.
So but
Yeah.
I need to learn more myself about these things.
It's I come from an radiology imaging background, and I was having lunch with a doctor one time, and he said to me, teach me all about your PET scan. And so it was interesting to me to have the physician say to me, that's non-clinical per se, to say, teach me. He said, no, we just don't, he was primary care. He said, I get this much. So it gives me an appreciation for the different specialties that are out there. But yeah, I bring that up. We're so in tune with trying to educate. And I think that's where our common ground lies with you, with dementia. It ties in with incontinence, but there's a lot to be learned out there about products and so forth. Getting back to dementia and Alzheimer's, we as a whole, right, we read a lot of things about some new medicines coming out, different things. From your perspective, when it comes to dementia, Alzheimer's, do you feel that there's newfound hope along the way?
Yeah, I think so. I think the research is the drugs will continue to hopefully evolve over time and get better, less side effects, and hopefully lower cost and better results. The medications, and I'm not an expert in this, but the medications I think are a piece of the puzzle. And I think that the medications that they're coming out now with the infusions that they have to offer people are going to be helpful for people who are earlier in the disease. So I think prevention is a huge thing, and I think decreasing stigma is a huge thing. And you just see it. You just see dementia kind of more in the news and on commercials and things. So I think, I am hopeful that things will get better. And I think just people being more aware that this is not normal aging is a really important thing. I can't tell you how many times I am telling family members in the emergency department, I'm pretty sure your person's living with cognitive impairment. Like, I don't know what it's coming from, but it sounds like it's chronic. It's been going on for a while. I'm concerned that they might be living with dementia, like which type of disease they have. I would need to like talk to them for a lot longer maybe to figure that out. But Sometimes I'm the first doctor that's saying something to them about it.
Wow.
Yeah, there's a
Wow
lot
is
of people
right.
a lot of people who are undiagnosed. Tons of people. So yeah, it's not normal aging if a person is having trouble functioning. You should be able to function independently as you age. That's normal aging. Forgetting things every once in a while is totally normal, but not being able to manage your world, right? And like be able to buy groceries and make sure that you've got food and make sure that your bills are paid. Like that is not, if you can't do those things, that's not normal aging.
What would be an example of maybe a conversation that you're having in an ER situation that would tip you off that they are struggling with this?
Yeah, so I sometimes will notice because I won't get answers to the questions that makes sense. Like I can tell the person is trying, but the timeline of what they're telling me doesn't make sense. I'm asking the question in multiple different ways and they're not understanding what I'm looking for. Um, I've also had times where I saw a patient earlier in the day and then they've been in the ER for several hours because we're waiting for a CT scan read to come back on something that wasn't the most important CT scan in the department. So they had to wait. And then when I come and follow up with them about their results, they like can't remember who I am or they don't like they're upset. Why am I still here? And I'm like, wait a minute, like we talked about why you're still here, you know? So it varies, but a lot of times it's just I'm very in tune with this now too because I do this online. So I'm like I think I'm constantly kind of surveilling to see if I see things. But yeah, those are some of the common things. And then people will sometimes call. I've had patients sometimes that call 911 for something, and then they get there and it's something concerning like chest pain or trouble breathing, and they get there and then they're like smiling, joking, interacting with me completely normally. Like they can't really remember or tell me why they called the ambulance, and I'm like, oh, that's not right, you know. So I don't diagnose people because it's not appropriate in the emergency department. But I will sometimes ask more questions of the family at the bedside if they come in or if they call me. And a lot of times I'll be like, oh, this sounds like it's been kind of an issue for a while. I bet your person's living with dementia. A lot of times they'll tell me, well, they won't go see the doctor. So like we've noticed something's wrong and they won't go. So, um, and that just one more thing on that is that when people are living with dementia at a certain point, a lot of them lose awareness of the fact that they are living with this illness. And there's a medical term for that. It's called anosognosia. So it's the lack of insight to the fact that you're living with a condition. And it's extremely common. And that's why sometimes when someone's living with dementia, if you say like I think you were living with dementia, they get very upset even though like it's apparent to everyone around them that they are. Like you can't. So there's lots of people online educating about how to interact best with people living with dementia. And that's something that I stress to everybody that I work with. It's a really important part of education. So because you really can make situations worse. We can, like how we respond to the person. So
Yeah. And how, I'm always curious, you had mentioned that you've been an ER physician for 10 years and then decided with the training for dementia. What drove that? Usually people have something internally that says I'm pivoting a little bit. I was just curious that our audience
yeah.
probably want to know.
Yeah, so I honestly, I mean, I mentioned at the beginning that I was burnt out. It's very frustrating to me. I've had multiple family members who have lived with dementia. I've counseled my husband's family as they've had adults who are living with dementia. And so I've seen how it personally impacts families, but also like it's very frustrating coming into the ER as a physician and like wanting to make sure that the person gets the type of care that they would want and nobody knowing what the big picture goal is. Like, are we trying to prolong life? Are we trying to focus on quality of life? Are we trying to just really focus on comfort? And I feel badly for people because they're so stressed out and emotional. They really have a hard time making medical decisions.
Mm.
And because they want to do what's best for their person, they want to do what's right in that moment. They just don't know. And in the ER, it's a stressful place to make decisions. And so what I find is that a lot of people wind up getting admitted to the hospital, having care that really does focus on prolonging life. And people don't understand the risks of hospital-based care for a person living with dementia. And so I sometimes see people who are really late in disease receiving care that I think is too aggressive, to be honest, like just too aggressive. And I have to check my own bias because I have a very strong bias towards living with quality of life. And so I just see this need for people to have more access to support in like figuring out what's okay and not okay before they wind up in the ER. And it's not always about end of life decisions. Like, you could be talking about how do we treat pneumonia? Like how aggressive are we going to be with pneumonia or sepsis or, or a fall with an injury? Sometimes we can do procedures and there's all kinds of decisions to be made and not all of them are about end of life. I think advanced care planning, we're making mistake, like telling people to think about the end of life. When a person living with dementia, every medical decision along the way really matters. So it's very frustrating. I don't like it. And so I said, well, I can educate people ahead of time. If their doctors don't have time, I'll just build something where they can go through it at their own pace and then they'll be in a better position to be able to interact with medical professionals.
Tell us about that. Make your plan with Dr. Lamb.
Yeah, so it's for anybody who is currently making medical decisions for someone living with dementia or knows that you're going to be and wants to work with the person in whatever capacity they're able to really figure out what's okay and what's not okay now and then into the future. So inside of it, I teach people like what it means to actually be someone's medical decision maker, what paperwork you should know about, the limitations of things like advanced directives, when to use them. And then the meat of the program is really medical knowledge. So it's information that people should know about what happens to people from a medical standpoint as they're living with dementia and aging. And then also medical emergencies that happen to everybody. Like just because someone's living with dementia doesn't mean they can't have a stroke or have something happen to their heart or be diagnosed with cancer. So it's how to set goals of care, like I kind of mentioned, prolonging life, quality of life, comfort. And then I teach the treatment options for each of the medical conditions that I explain. Full treatment, some but not all care, some but not all medical treatment, and then comfort focused treatment. So it's really just like a one-stop shop for all things medical decision making when you're advocating for someone living with dementia.
How would people access your program or get more information about it?
Yeah, so if you go to my website, it's my first name is Brittany, so it's B Lamb, my last name's Lamb, so blambmd.com. If you go there and then you say, I think it's at the top, it says like start making your plan now, that will bring you to a page you can read about the program. I need to update that page. It may be updated by the time you're watching this. And then the other way is that if you sign up to receive my emails, you can ask me questions. Any questions, I respond to the emails that I get personally. So if you go to blambmd.com/email, you can put in your name and your email address and then email with me. I send out emails usually once a week and I do like live Q&A sessions for people. That's for free and offer resources and stuff there for support. So, but if you had questions about the course, you could ask me via email.
That's awesome. Thank you. You are such a kind individual. When you just were saying that to people that are going to be watching this, that I email back people and so forth. I'm just such an advocate that everybody in our country, I feel like, needs some type of navigator within their circles to help navigate the healthcare system, navigate senior living, navigate aging. And so the fact that you're a physician that has a program and reaches out, has newsletter and has free resources. I mean, it's impressive. It's very impressive. It's kind. We need more Brittany Lambs in the world.
Yes. Well, I mean, thank you for saying that. I know there's a solution to this issue that I keep seeing, and it's just the right people too, because I know that it's overwhelming when you're trying to navigate all of this. And so it's the right place at the right time and when people are ready. And and really ready to like learn and dive in. And sometimes there's some emotional stuff that needs to get worked out. You know, I try to offer support with that, but I'm also not a therapist or a counselor. But I try to tell people that you're going to need one probably. So yeah, there's so many issues inside of our healthcare system. And so I think this has really helped me not quit working in the ER, honestly. Doing this work online has given me a longer career in the ER. So
Yeah.
Well, I can think too that if somebody is nervous about symptoms that they've had, they don't want to talk to a doctor because perhaps they're thinking the doctor's going to give me bad news. And I don't want to face that. And yet I want to applaud you, Dr. Lamb, because your whole demeanor, the tone in your voice, your smile, your friendliness, might help someone see that it's not about getting bad news. It's about accessing resources like your website and getting solutions and a path to go on. And thank you for doing that. I think this is extremely valuable to families.
Well, thank you. Yeah. And I would just say to that is that if you feel like you don't have a good interaction with the doctor, maybe you get a different doctor or interview doctors and say, like, how many people do you care for who are living with dementia? Like, you know, because doctors have different interests and experience. And so if you're going to seek help, I think keep that in the back of your mind. It's your life, it's your body, it's your health. So if something doesn't feel right with the care team that you have, like, I know it can be challenging to find other people, or insurance things and all that. It's time consuming and everything, but it might do you better in the long run to find a care team that understands and will support you along the way.
I think that's great advice. I think that's a change from years and years and years ago where people had one physician and that was the one physician, good, bad, or indifferent. There are a lot of wonderful physicians out there, but now I think people are realizing choices and it is a person's body and healthcare. And like anything else, you click with certain individuals and others you don't, and so be it. So yeah. Thanks a million for taking your time. Honestly, I know how busy you are. Susie and I appreciate it. And we always say on this show, it could just be one individual that your advice helps. But if that advice is, someone's mom, someone's dad, then it helps. So thank you.
Yeah.
We appreciate you. So great. Side note, I will be reaching out to you to see about the Caregiver Forum for 2025 to kind of look at that again. And we thank you for doing that this past year. And I think we're going to round up the troops and see what the interest level. So I'm not going to put you on the spot here. But
yeah, no, you'll have to let me know. I mean, that's how, I don't know if I told you, but that's how I got offered the job as medical director. They asked me after I spoke there, they asked me to be their medical director. And I was like, I don't know how I'm going to be able to handle this, but then it just, yeah.
Wow. We've extended this another 5 minutes here, but that's awesome. I did not even know that. That's kudos. Congrats.
Yes.
I love that.
Thank you.
Ripple effects. Love that. Well, super. Well, thank you so much. We appreciate it. Thanks, Susie. And
thanks,
I'm going to
Susie.
stop recording right here. Let's see.